Okay. Well, good morning. On behalf of the University of Iowa Hospitals and Clinics, we thank you for attending today's presentation, How Physicians Can Help Patients with Depression and Anxiety During COVID-19, with Dr. Allison Lynch. Our faculty's goal is to share information you can use about the latest therapies and techniques in medicine and answer your questions about how to partner with us in the care of your patients. These are informational presentations to enhance your clinical practices and to provide you with the most updated information we have. No CME credit is provided at this time for these presentations. However, in the very near future, and actually currently, we are offering our grand rounds regarding COVID-19 as opportunities to earn CMEs. You can find this information on our referring providers education page, where you can register for those CMEs, but they are specifically regarding our grand rounds. And we can reach out to you with more information as well. Please note that the information regarding COVID-19 is constantly getting updated, so information in any of our presentations may change over time. This program is being recorded and will be posted to our educational resources for referring physicians webpage. We do encourage questions throughout the program with the chat function. You can also unmute yourself as well. And at the end of the presentation, we'll certainly have time for discussion and questions for Dr. Lynch. At this time, I'd like to introduce Dr. Lynch. She is a clinical professor of psychiatry and family medicine at the Carver College of Medicine, and she's the director of addiction medicine at the UIHC as well. So at this time, I'd like to turn it over to Dr. Lynch so she can begin her presentation. Thank you for joining us.
Okay, thanks, Randy, and thank you everybody for joining us this morning. So I'm going to talk about how to help patients who have depression and anxiety about COVID-19. And, I think some of this is also just about how to help patients who have depression and anxiety during COVID-19. We're certainly seeing plenty of anxiety and depression right now. Some of it's about COVID and some of it's just due to the rapidly changing climate and uncertainty that we're living in right now. So hopefully this will be helpful whether your patients are worried about COVID specifically or just worried in general. Okay, I don't have any financial conflicts of interest related to the information and topic that is presented today, but I do love that little emoji with the mask. So our objectives are to review mental health and our mental health care system just a little bit pre-COVID, and then we'll examine how the pandemic is impacting mental health and discuss some strategies to help our patients with depression or anxiety symptoms either about or during COVID. Okay, so we'll talk a little bit about mental health before the pandemic. So before COVID-19, the mental health our mental health and our mental health care system were already underwater, if not in crisis. For example, suicide is the 10th leading cause of death in the US. Between 1999 and 2016, rates of suicide increased 33%, with the greatest increase in rural counties. In 2017, over 47,000 Americans died by suicide, which is 14 per 100,000 individuals, and there were 1.4 million suicide attempts. Veterans, Native Americans, men between the ages of 45 and 54, and rural populations, and counties where with a higher percentage of uninsured people and higher percentage of gun shops have higher rates of suicide. As far as children's mental health goes, a recent study in pediatrics showed that emergency room visits for children presenting with mental health issues increased 60% between 2007 and 2016, so over a 10-year period. And during that time, the number of visits to emergency departments for children overall, for all reasons, stayed about constant. But the proportion of them that were related to mental health issues went up dramatically. Our nation's been experiencing an opioid epidemic. In 2017, over 70,000 Americans died of a drug overdose, and 70% of those involved in opioid. Burnout among physicians has been a real problem. In 2019, Medscape issued the National Physician Burnout and Depression Report, and it stated that 44% of physicians surveyed reported feeling burned out. 11% reported feeling down, blue, and sad, and 4% were clinically depressed. And then just as far as psychiatric hospital beds, at our hospital and around the state of Iowa, psychiatric hospital beds are frequently full, and patients sometimes spend days in an emergency room waiting for a bed. So all of those things were going on and in the background before the pandemic hit. And so that's where we started. All right, so this is just a very quick timeline to show a few key points over the last couple of months during a period of tremendous change. So it was only December 31st, so just several months ago, when we first heard about reports of a cluster of cases of pneumonia in Wuhan in the Hubei province of China. And eventually the novel coronavirus was identified as the causative agent. Then by mid-January, the first case of COVID-19 was identified outside of China. This was in Thailand. By January 30th, the World Health Organization declared a public health emergency of international concern. And by March 11th, the WHO characterized COVID-19 as a pandemic. So just in that very short time frame, things have changed dramatically. It sometimes felt to me like we were out on a ship at really rough seas, like we'd lurch one way and then we'd lurch another way. And I started to feel like it was like being seasick, like things were changing so quickly. It was so hard to keep up with it. So how is the pandemic affecting our mental health? In mid-March, the American Psychiatric Association commissioned a study of US adults to find out how the pandemic was affecting people's mental health. And it found that 19% of the people surveyed were reported having trouble sleeping. 8% reported consuming more alcohol and other drugs or substances. 12% reported fighting more with a partner or loved ones. And 24% reported having more trouble concentrating. They also found some additional findings in this study that just reflect how much anxiety is out there about the pandemic. So in this same study in mid-March, 48% of the people surveyed felt anxious about getting the virus. 44.1% felt anxious about spreading the virus to loved ones. 50.8% felt anxious about family and loved ones getting the virus. 47% worried about running out of food or medicine or other supplies. 57% were concerned that the coronavirus will have a serious negative impact on their finances. And 36% said that the coronavirus is having a serious impact on their mental health. And as we continue to deal with COVID, evidence that the pandemic is having an impact on our mental health continues to grow. So at the end of March, a Kaiser Family Foundation poll found that 45% of Americans surveyed were reporting that the coronavirus is affecting their mental health, and 19% said that it's having a major impact on their mental health. The SAMHSA, which is the Substance Abuse and Mental Health Services Agency, it's a government agency that provides a lot of services and resources related to mental health and substance use. One of the things that they do is they run a disaster distress helpline, which is available to call or text 24 hours a day, 7 days a week. And in the month of April 2020, they received 22,000 texts, which is more than a 1,000% increase compared to April 2019. So as we turn our attention to concerns about the infection, we may be failing to focus on the mental health aspects of the pandemic. The graphs on this slide are from a recent study that looked at over 2.5 million emergency room and clinic visits for people ages 13 and older at 5 different hospitals in Eastern Massachusetts between January and March 2020. So a 3-month period just recently. And they found a significant decrease in the number of visits that had documentation of depression, anxiety, psychosis, suicide, or violence. So you can see I don't know if you can see my cursor, but in the graphs at the top, it's lab orders. And you can see that both at the academic medical centers and the community hospitals in the study, lab orders went way up towards the end of that period. And then the graphs on the bottom are looking at documentation that references symptoms related to depression, anxiety, psychosis, suicide, or violence. And as we get towards the end of that 2-month period, notation in both the academic medical centers and the community hospitals related to anxiety and depression were going down. So the concern is that as attention has been redirected to the virus, we may be missing opportunities to identify and treat mental health problems. It is unlikely that mental health problem or issues are not mentioned in the notes because they've suddenly improved. They're just being, our attention is being distracted elsewhere. Okay, so the mental health effects of pandemics have not been widely studied, but there is some information that suggests that pandemics lead to worse mental health. During the Spanish flu pandemic between 1918 and 1919, in Norway, a study looked at first-time psychiatric hospitalizations in Norway during the 6th period afterward, after the Spanish flu, and found a 7-fold increase in first-time psychiatric hospitalizations after the Spanish flu pandemic. Spanish flu survivors reported sleep disturbances, depression, mental distraction, dizziness, difficulty coping at work. From a different epidemic, in 2003, the SARS epidemic, one study looked at suicide rates among older adults in Hong Kong, which was the country that was more heavily affected by SARS, and there was a 30% increase in suicides in that population. So we know that stress can cause a number of physiologic and cognitive issues, and the COVID pandemic is quite stressful. Stress increases our activation of adrenaline and also our adrenergic system. We get into the fight or flight mode. We don't concentrate well. We get distracted. We feel detached. When we don't pay attention, we don't remember things well later. We don't sleep well. We may have stressful dreams. We may experience physical symptoms like tachycardia, hypertension, sweating, headaches, but just overall, we do not feel good when we are under huge amounts of stress. Many of the reactions and consequences of the pandemic are causing us significant psychosocial stress. There's the fear of getting sick and the fear of the future. There's social isolation that comes from the physical distancing that is required in order to reduce the spread of the virus. Another consequence of the of physical distancing and other measures to reduce spread of the virus is decreased access to our usual community and religious support services and structures. There's the impact of job loss, financial fears, stress, and financial loss, and then the significant disruption in routines, plans, and expectations. We don't know yet what the statistics will tell us later about all the mental health trends that we're experiencing right now and in the future after this pandemic, but there are a number of clues that we will need to be paying attention to as we move forward over the next couple of months and years. One thing that I think is important is we know that in the Northern Hemisphere, suicide rates tend to peak in the late spring and early summer, and we're just heading into that time of year. Another thing that's of concern, many news outlets were reporting a surge in US gun sales as COVID-19 was erupting, and firearms are the most common method of suicide in the US, and firearm ownership or access and unsafe storage are associated with elevated suicide risk. Another sales issue that could be a clue, in late March, alcohol sales rose 55%, which raises the concern for increases in at-risk drinking. as well as relapse for people who've been in recovery from alcohol use disorder. And experts are predicting that substance use in general and opioid-related overdoses specifically may go up during the pandemic as people use substances to cope with depression, anxiety, job loss, financial stress, and boredom. Okay, so we've all heard about the possibility of a second and a third wave of the coronavirus pandemic, which means a rise in cases of COVID-19. We don't really have a well-researched model for the mental health waves of a pandemic, but here are some of the possible aspects of what we might expect in the coming waves of mental health issues that are caused by the novel coronavirus pandemic. So of course, initially we're seeing a lot of fear, anxiety, and emotional distress. For some people, this is going to be very traumatic, and they may feel the consequences of having experienced a severe trauma. After a while, people develop fatigue, numbness from uncertainty and dramatic change. Social isolation has a lot of impact on our well-being and can fuel depression. I think we'll see grief with a lot associated with the losses that people are experiencing as a result of the pandemic. Experience of a pandemic actually doesn't qualify as a kind of trauma that can cause PTSD according to DSM-5, but I think we will see a lot of people who have emotional consequences from having experienced the trauma that living through a pandemic is. And then eventually recovery. You know, I feel like these waves bear some resemblance to the Kubler-Ross model of the grief stages. And I hope that we see more research on trying to identify really what are the mental health waves of response to this kind of a global pandemic. There are some populations that are more vulnerable to the psychosocial effects of a pandemic. Of course, people who contract this disease are at higher risk for things like depression and anxiety related to the pandemic. And even people who don't contract the disease but are just at heightened risk are also more vulnerable to the psychosocial effects of the pandemic. People with pre-existing medical conditions or psychiatric or substance use conditions are generally at heightened risk of the disease, so they kind of fall into that latter category, and this is a very stressful time for them. Also, people who have barriers to accessing prevention or protection or treatment or other resources are at higher risk from psychosocial effects of the pandemic. And this would include people who work in jobs where there's a lot of exposure. They may be on the front lines, or they may be driving a bus, or working at a grocery store, or working in a meatpacking plant, or someplace where they're either have higher exposure to the public, or not able to practice the strategies that we know that can reduce or prevent transmission. So when people are not able to protect themselves as much as they would want to, of course, that makes them more vulnerable to depression and anxiety. And of course, people who lose family members, loved ones, coworkers, or even just neighbors, people that they know, to the disease are at risk for being affected, their mental health being affected. And then we know that healthcare providers, especially people that are interacting directly with patients, both who are being evaluated for COVID, or being tested, or being treated, or just worrying about it. The experience of working with that patient population makes healthcare providers more vulnerable to mental health consequences from this pandemic. And I should also mention that communities that are more vulnerable to adverse health outcomes in general, such as communities of color, communities with less socioeconomic capital, people with mental health and substance use disorders, and other disempowered groups, are more heavily impacted by the pandemic's effects, just like they are, unfortunately, from most health issues that face our society. It is important to remember that most people will adjust to all of these changes without intervention from a professional. So I think, the role of reassurance should not be overlooked. And some people will actually find new strengths and opportunities on the road ahead. So I definitely don't mean to be a doomsdayer about this. And I do think that one of the things we need to focus on is adjustment and recovery. And the good news is that people are resilient, and most people will be able to make this transition without professional help. Many people will experience some or many of the following symptoms during their lifetime. The symptoms of depression or anxiety, which I've listed here. Some of these are the DSM-5 criteria, and others are just more clinical signs that you may see in your patients that would be indicators that they're dealing with depression or anxiety symptoms. Experiencing any of these symptoms is common for human beings in their lifetime, and it's even more likely during times of high stress, like a pandemic or losing a job or illness or financial distress, which are all more prevalent right now. The symptoms might be an exacerbation of a pre-existing mental health condition. They may rise to the level of being a clinically diagnosable disorder, or they might be symptoms that don't meet full criteria for an actual diagnosis, but they can still be uncomfortable and unwanted. I will just remind you that in order to meet DSM-5 criteria for a clinical depression or anxiety disorder, that symptoms must be present most of the time for at least 2 weeks. So, now that I hope I've made the case that, and I probably didn't have to convince very many people, that we really are dealing with a lot of people who have worsening or new mental health concerns. I want to spend a little bit of time talking about some suggestions for what we can tell our patients who are feeling depressed or anxious about the pandemic. And so I have a list here, and then once I'll read them off, and then we'll go through each one individually in the coming slides. So one thing is to focus on what we can control. Another thing is exercise. Self-care is important. Be creative to find ways to stay connected to other people. Practice mindfulness, set boundaries with media consumption, and ask for help. So, it's important to focus on what we can control. Establishing a schedule and developing or maintaining routines can help us connect to the things that we do have some control over. If you're working from home, don't work from bed. Get up, get dressed, shower at your usual times, have meals when you usually do, put your kids to bed on time. All of these things help maintain some kind of predictable structure, which is just reassuring to people, and helps us feel like something is both under our control and preserved, even though lots of other things outside of our environment are changing rapidly. Make your environment safe and comfortable. This might be things like, snuggling with a favorite blanket, using scented candles, decorating your space with mood lighting, plants, photos of loved ones or pets or nature or art. And then, but just making it comfortable. If we're going to spend extra time at home, it should be a comfortable, cozy place. And as far as as safety in our environment goes, make sure that medications, firearms, and other items that may be accessible are stored securely, especially for patients who have suicidal thoughts or severe depressive symptoms. Making sure that the environment is safe would include putting some barriers between the individual and things that they could use to hurt themselves or take their life. As far as the extra time that we have on our hands, a lot of people report feeling bored, and I think one of the things that we can do to try to reframe that is to think about what do you want to do that you don't usually have time to do, and think about trying to use our time differently. Setting goals or each day can help structure time and make you feel like you're accomplishing something. Taking breaks is very important. And it's also important to be gentle to yourself and acknowledge that we're experiencing dramatic and rapid changes and that there's a lot of uncertainty, and this is really difficult. We all know that exercise is beneficial in so many ways, and it really is true. We know that exercise improves mood, it reduces anxiety, it's good for our heart, it helps us sleep better, and it helps us maintain a healthy weight. It probably helps us prevent cancer and does many other healthy things for us. Sometimes it's hard to get started with exercise or to get out the door to go exercise. And I know personally, I don't always feel great while I'm exercising, but I pretty much always feel good after I'm done. And I love the feeling when I just remember in the middle of the day, hey, I already exercised today. So when I need motivation to get started with exercise, I try to remind myself of how good it will feel after I'm done. And I think trying to get some exercise 4 times a week is, for many people, a reasonable goal. It does not have to be highly intense. Obviously, right now, people don't have access to gyms and some of the other exercise resources that they might have been able to use previously, but there are things you can do at home and in place. And there's always barriers to why somebody is not able to get started or continue exercise. And so focusing on identifying what those barriers are and try to find ways to overcome them, I think is important and helpful. So self-care can take a lot of different forms. Managing or adjusting expectations, setting aside time to do the things that give us pleasure, being vigilant about getting good sleep, eating healthy foods, staying hydrated, taking prescribed medications, following medical and public health advice. And I will just add to on that note, there's growing evidence that wearing a mask decreases the transmission of the novel coronavirus. So we should tell our patients that wearing a mask helps reduce viral spread. We also need to stay up to date about other interventions that may develop, including treatment, prevention, and immunizations, because our patients look to us for guidance on these medical issues, and we need to be up to date with the current science and evidence base in these topics so that we can give them good advice that they can follow to practice self-care for their health. Being careful with substance abuse is important. We do expect to see increased rates of substance use right now and over in the coming months as a consequence of the pandemic. Learning a new skill, taking advantage of the extra time that you have can be a good way to practice self-care. There's good evidence that focusing on what we are grateful for, even in the midst of lots of things that we're not happy about, can improve mood. And helping others is also a good way to help yourself. That might include reaching out to somebody, family member or neighbor who might be isolated or appreciate just getting a check-in. It might be donating money to a cause. But we do know that helping other people helps ourselves. So the way we connect with others has changed, but that does not mean that it isn't extremely important. Social connectedness is a basic human need, and it's also protective against suicide. So it's really critical that we encourage people to find ways to overcome the barriers that have affected our usual ways of communicating. Advice you can give to patients would be to reach out to others when you feel lonely. A lot of times when people feel lonely, they focus on that nobody is reaching out to them. And if we can turn that around and encourage them to identify that when I feel lonely, I should reach out to somebody else, that can help us get them connected to somebody, and it might help somebody else who was feeling lonely too. Things like scheduling regular times to talk with people, talk with loved ones, or meet by video conferencing or a Zoom meeting or something. Setting up a group chat through text messaging, calling older neighbors or relatives who live alone just to check in with them. Writing letters is a good way to stay connected. Sharing photos with friends or loved ones is also a good way to stay connected. And for people who are working at home, doing a virtual coffee break with coworkers can be a good way to stay connected to your colleagues. Mindfulness has been shown to reduce stress, anxiety, and depression, and these are just a few of the key concepts for applying a mindfulness approach to life. Be present in the moment, breathe, and focus on your breathing. Take time to sort of step back and think about your breathing and slow down your breathing. Connect with nature and the outdoors. This might be through gardening, having plants in your home, looking at pictures of wildlife, taking walks, and meditation. That might be guided meditation, doing a body scan, practicing yoga, but all of these things help promote the sense of focus on the moment and can help us reduce our stress response system. Okay, set boundaries with media consumption. I think this is really important, and I certainly hear patients telling me that they find reading the news or looking at Facebook or other online chat venues very stressful. So we can tell our patients that they can set intentional time for media consumption. So it doesn't mean you can't ever look at anything, but maybe plan to look at the news or social media for 15 minutes at a time, maybe once or twice a day, rather than endless scrolling. It's also important to seek out trusted sources. Be cautious because there's a lot of misinformation out there, especially in social media. So I think the more we can use our time, our intentional time for media consumption focused on sources that we trust, that's going to be less stressful than getting caught up in a lot of misinformation and conspiracy theories and things like that. You can turn off notifications from social media so that it doesn't disrupt you all the time. And it's probably a good idea to avoid watching the news right before bedtime. Other people may find that reading the comments on social media posts are very stressful, so that's not necessary and you can avoid that. Finally, it's important to ask for help. There are hotlines available for people in crisis, and I have some resources at the end of the slide deck that have some suggestions for those. There are online support groups. Mental and behavioral health care is available through telemedicine, and I'll talk a little bit more about that in a moment. And then crisis planning is important, so for somebody who's really struggling with mental health issues, talking with them before it reaches the crisis point about who they're going to call, what symptoms are going to trigger them to ask for help so that they know what to do when they actually get in a crisis, can be helpful to just so that they know kind of how to proceed when they get to that point. So for people who have pre-existing or new onset depression or anxiety that warrants treatment, by all means proceed with your usual recommended treatment plans for these conditions. In general, SSRIs are first line, but SNRIs and bupropion are also reasonable options. Psychotherapy is also a recommended option, either alone or in combination with medication. And I'll just point out that lately many therapists are offering the option to do psychotherapy over the phone. There are also web and app-based programs to deliver psychotherapy remotely, and I have a couple of those listed at the end of the slideshow. I mentioned crisis planning and how important that is. Asking about suicidal thoughts does not increase thinking about suicide, and it can provide an opportunity to give advice and offer resources. And all of the self-care stuff and support that we talked about in the last few slides are also very helpful for people that have a diagnosable depressive or anxiety disorder that warrants medical treatment. So just a little bit more about telehealth. Several rules and laws have been temporarily modified or suspended during this public health emergency that make telehealth more accessible. One of them is that now telehealth can be delivered to patients at their home, so they don't have to travel to a qualifying originating site, like as was the case before the public health emergency. CPT codes that were developed for in-person visits can currently be used for phone and video visits. And for patients with substance use disorders, treatment with controlled substances such as buprenorphine or methadone can be delivered to patients through telemedicine. Buprenorphine in particular is the one that really has been able to be delivered differently for treatment of opioid use disorder. And that's because they've suspended the Ryan-Haight Act, which requires controlled substances to be prescribed after an initial in-person visit. So that act is currently suspended, which allows more use of telehealth to treat addiction and other conditions that are treated with controlled substances. So we know that telehealth visits went up 50% in March, and they're predicted to top 200 million visits this year. Prior to the pandemic, the prediction for 2020 was 36 million visits, so up by about a factor of 6. And there was a nationwide study that was conducted by the University of Chicago recently, looking at older adults, and found that 1 in 5 older adults have had a telehealth visit during the first 2 months of COVID. And of those who had the telehealth visit, 59% of the experience for them was the same or better than an in-person visit. And I just know from my own experience, I'm finding that my patients really do appreciate the option to do telehealth visits, either because it's more convenient if they live from a distance away. If they are working, they don't have to take as much time off of work to stop and have a visit with me. And if they're afraid about getting sick or catching something by coming into the office, by being able to do a visit through telehealth, then they don't have to worry about that as much. All right, I just want to say a couple words about public health and mental health. I don't know about you, but I have definitely gained a new appreciation for the value of public health over the past few months. I have a better understanding of the role of public health and how it can help us with prevention and intervention during a pandemic. I also have a better understanding of what contact tracing is and social distancing is. These are concepts that I had heard of before, but never really understood how they would work. And I appreciate how quickly a community can mobilize when needed, much quicker than I would have imagined, to do things such as closing schools and businesses or getting people to wear a mask. As we look forward and think about what we want in a public health system in the future, I believe we need to envision a public mental health system too. I'm not sure what that would look like, but I do have a couple of ideas. First of all, mental health needs to be fully integrated into general pandemic healthcare. I think it's going to become more and more clear how important mental health is during a pandemic. At the same time, many COVID-19 cases are going to be identified and treated in healthcare settings by workers with little to no mental health training, and the critical role of mental health might not be appreciated on the front lines. The integration of mental health needs into COVID-19 care must be addressed at the organizational level through state and local planning, through mechanisms for identifying, referring, and treating severe psychosocial consequences, and ensuring the capacity for consulting with specialists when needed. Another interesting public health approach to mental health is the use of lay health workers. And there's a few studies that have shown that lay health workers can be deployed to out into the community, kind of like contact tracers in a sense. And what they do, they can improve the mental health of the community by increasing the use of evidence-based practices. And they're also able to reach more people in underserved communities that are not as easily accessible to our usual healthcare system. And given where our mental health system was at the beginning of COVID, I think we're going to really need to think about using new tools and new models of care like this to address the mental health effects caused by the COVID pandemic. Okay, one more thing, our role. So we are role models for our patients, and our patients look up to us. Think about how comforting it is when someone you respect says confidently, things are going to be okay. Our patients need to hear this from us. Studies show that Americans trust their healthcare providers the most when it comes to getting information about the coronavirus. We are in this together. We have made it through difficult circumstances before. Yes, there are good reasons, justifiable reasons to feel depressed or anxious, but we can also look and find reasons to be joyful and comforted. The more we can focus on managing our own emotions, the better prepared we will all be to face the future, whatever it holds. And so I just need to make a plug for physician self-care and practicing all the things that we're going to tell our patients to do to manage depression and anxiety, because if we don't take care of ourselves, we cannot take care of other people. Okay, so this is just a slide with some resources, and I'll just kind of go through it. I've got some smartphone apps. The first three, so there's COVID Coach, which is a VA app, and that has a lot of kind of stress management, mindfulness, mood logging tools that may be helpful to people as they're coping with depression and anxiety symptoms or just the stress of the pandemic. And that's from the VA. It's free, and you don't have to be a veteran to access it. It's just an app you can download on your phone. T2 Mood Tracker is another app that helps manage depression symptoms and provide some feedback about depression symptom management. It's CBT, or cognitive behavior therapy based. Breathe to Relax is more of a mindfulness focused app. And then Mood Gym actually does have a cost, that's why I put that on there, but it's not very expensive. And that is another CBT based tool that delivers advice and exercises and other tools to help manage depression and anxiety, and has a decent evidence base for its effectiveness. As far as hotlines, so Community is the Johnson County Crisis Center, and your county probably has a different name for their crisis center, but looking to your local crisis center is one place, but many of them have 24/7 hotlines for people in crisis. Then there's also a number of national hotlines. One of them is, or actually two of them are through SAMHSA, which I mentioned. One is the Disaster Distress Hotline I mentioned, which has had a huge increase in use. And SAMHSA also operates another hotline for people in mental health or substance use crisis, and those are available on their website. And then there's the American Foundation for Suicide Prevention. They have a hotline that can be accessed by phone or text 24/7. And the Mental Health America Crisis Text Line, which looks like it's the same one as the American Foundation for Suicide Prevention, where people can text when they're in crisis and get a response from a trained peer support specialist right away to assist them in navigating through suicidal thoughts. Then there are a lot of online support groups, and the ones I would highlight are NAMI, the National Alliance for Mental Illness, which has a lot of support groups both for individuals dealing with mental health issues and also family members of individuals who have mental health issues. Mental Health America has an online community support group for people that have mental health concerns. And then Alcoholics Anonymous, Narcotics Anonymous, and Smart Recovery all have many online support groups right now. I read somewhere that every 6 minutes you can log into a starting support group between these three organizations around the world. So that's very accessible right now. And then there's some online resources on websites at the American Foundation for Suicide Prevention. Your Life Iowa is the website that is run by the Iowa Department of Public Health, which has a lot of great resources. Getting started with mindfulness, if you have this as a PowerPoint, you have a hot link to it. It's www.mindful.org. And that has a lot of useful tools and information about mindfulness that are freely available. And then finally, SAMHSA, the Substance Abuse and Mental Health Services Agency, has a lot of online resources as well. And their website is www.samhsa.gov. Okay, and my last slide is just some references from some of the stuff I presented earlier. So maybe now I'd be happy to answer questions if people have any.
I have one for you from the group.
Great.
How prevalent do you think the extent of mental issues with providers may be?
Oh, and I think we, so we, I think we will know a lot more about that over time as that gets studied. I think one of the things that we have done at our hospital is we created an in-house 24/7 crisis line for any healthcare worker who has a crisis and wants to talk to somebody, either just to kind of debrief or get advice about whether they need to seek professional help. And we started that in mid-March, I think. And we've been getting, on average, 1 call per day, and that's just from within UIHC. So I think a lot of people are finding this very stressful, and some people are reaching out. But I think it's gonna, typically what happens when people are in crisis is that the adrenaline kicks in and they kind of focus and they get into survival mode, and they just focus on sort of trying to get through the day. And it's often a little bit later, after some of that dust settles a little bit, that people start to reach for help and realize how much they've been affected by a very stressful situation. So I don't know if that's not a very specific answer, but I definitely think, from what I'm reading nationally and what I'm seeing clinically, that it's definitely rising, and I think we're going to see it to actually be even more of a problem over the next year.
Great, thank you.
Yeah.
As a reminder, if you do have questions, you can certainly use the chat function, or you can unmute yourself as well and ask the question directly.
I guess if I also would have a question, if anybody in the audience has any other thoughts of things that they have found helpful using with their patients that are experiencing depression or anxiety, I'd love to hear them.
Will this slide deck be available for those that participated?
Yes, we are recording this, and we will be sending it out to everyone who registered, as well as posting it on the referring education page.
Thank you.
I have a question. Have you found that among the physicians that certain specialties are more prone or are feeling depressed as opposed to others, just because of their work? For example, the intensivist and like maybe even palliative or hospice physician, because they're not able to be with the patients like before. And I am a palliative physician, and I unfortunately had to see one of my patients dying via telehealth, which was not easy.
Yeah.
And so have you seen anything like that, or like one specialty versus, or it's like just journal?
Yeah, I have not seen any kind of aggregated data about that would tell us more about which specialties are more vulnerable or more impacted. I've certainly seen a number of individual stories from different physicians and different providers, different healthcare workers. But I don't think we know yet if like nurses are more vulnerable, or if palliative providers or if intensivists are more vulnerable, or yeah, I haven't seen any data about which group is experiencing more stress or more distress. But certain, I mean, there are just some heartbreaking stories out there of clinicians having to make tough decisions, or being involved with patients who have to be separated from their family member as they're dying. From what I've read, the people that are telling those stories of that experience, that's really heart-wrenching to them.
Thank you.
Allison, I think I'm surprised when I talk to my patients about their degree of anger politically. I've not come across this to this extent in my career before, and I'm finding it hard to separate out, okay, you have fear and you have concerns, but you also have anger. And the political divisiveness in our country is, I think, impacting this. And if you had any comments, I would appreciate how to try to approach that.
Yeah, that is a, I think it's another one of those things where we got a pandemic on top of a problem that was already there, right? So there was a lot of
Yeah.
political divisiveness before this even got started, and this has just added fuel to that. You know, I think anger is often driven by anxiety and depression or fear. And so I still think a lot of these kind of self-care things, and in particular, you know, trying to identify what is fueling this. And for many people, it's watching the news and engaging in social media. And you know, even if somebody doesn't believe that that's what's causing their problems, maybe asking them to try to go a few days without consuming that, and then reassess and see how they feel. It might, you know, may be hard to see when they're sort of surrounded by news and social media feeds all the time, that how much of an impact it's having on them. But if they step back from it, they might be able to see that it's part of the problem. I think also, you know, that there's messages out there, you know, we're all in this together, trying to come up with ways to help people see that this is going to be more effective if we can work together, and that setting up barriers does not work to protect ourselves or prevent viral spread. I think there's so many examples of how there are barriers in place and divisiveness, and yet this virus is able to transcend that. So clearly that doesn't work. Yeah, I think just trying to help people tune into how to help themselves and how to calm themselves down, and kind of get a break from the stress of all of this. I don't have a foolproof answer, but I do think that helps. I'm sure you've tried that. Cindy, what do you think? What has been, what have you found anything to be helpful to sort of defuse those conversations?
The most helpful is to tell them to turn the TV off and the media off. And then I just try to emphasize that this is a virus. It's not political. It's not a war. This is a virus.
Yeah.
And it has no feelings.
Yeah.
And then people will laugh at me, and if we can get to a little laughter, that diffuses some of the anger.
Absolutely. Yeah, I personally don't feel that this at war and kind of warlike motif for what we're going through is helpful. Just because that's not what we're not at war. I do think it's easy to mobilize people to act when we have this sense of like it's us versus them. We're at war with something, but in the end, I think it brings out a lot of hostilities and anger. So I'm personally trying not to use that motif. I don't know if that helps, but something to consider. Were there any other questions in the chat group? I'm sorry, I can't really watch that while I'm doing the talk.
Nope, but if we have time for one or two more, otherwise we can start to wrap it up.
Has anybody used any of these smartphone apps?
No. I'm going to recommend them though.
Yeah, I would encourage you to. I mean, it's a resource for sure, and I've downloaded all of them and used all of them at least a little bit, and they're easy to use, and I feel like they add a little bit of structure to self-monitoring, which can be helpful. I think people seem to like different aspects of them. Some people like the mood tracking aspect. Some people like the meditation, the guided meditation, or guided breathing.
Okay. Well, we're right before the 8 o'clock time, so we can let everybody get on with their important work and busy days. So thank you for attending today's presentation with Dr. Lynch. I think it was very beneficial for everybody in their practice, but then also personally. I think it's going to be helpful for everyone. We will be sending the presentation in a follow-up email, like I said, and posting it. And just as a reminder, there are opportunities for the CMEs regarding the grand rounds for COVID. And we encourage you to visit that as well. And if you do have questions following this, you can always feel free to reach out to your provider relations manager or Dr. Lynch, and we will get that to her. So thank you again for attending, and we will let you guys go today. Have a great day.
Thank you, everybody.